So today we'll be talking about mitral annular disjunction. So you could have it without mitral valve prolapse, but it is usually seen in subset of patients with mitral valve prolapse. So what is it? It is a systolic gap between the insertion of the posterior mitral leaflet and the basal infralateral myocardium. As can be seen in this transesophageal echocardiographic clip, that there is mitral valve prolapse, and the origin of this posterior mitral leaflet is at a bit distance from the ventricular myocardium. Moving on, in this schematic diagram, you can see that's how a normal mitral annular plane look like, originating from the atrioventricular junction. But in patients with mitral annular disjunction, the origin of this posterior mitral leaflet tissue is actually at a distance from the junction of the thin-walled atrium and thick-walled left ventricle, and this distance is measured and is called as mitral annular disjunction distance. And why it's important to measure it, because it can potentially alter your technique of repair. So simply there is origin of the mitral leaflet component or the leaflet itself at a point distanced from the junction of the left atrial and left ventricular myocardial tissue. Histologically, you see this whitish fibrous structure that is the mitral leaflet annulus, and it seems to normally it originates from the junction of the thin-walled left atrium and thick-walled ventricle, left ventricle. But in patients with mitral annular disjunction, so you see a lot of blue thing in this panel B. It's actually because of increased content of fibrosis. Not just that, but this annulus is trying to extend from the thin-walled left atrium. On an echocardiogram, the panel E is a transthoracic echocardiogram, and you see that there is a certain distance between the origin of the posterior mitral leaflet and the atrioventricular junction. That's where the left ventricle thick-walled is having a junction with the thin-walled left atrium. And then in the panel B and C are the transesophageal echocardiographic clips, and you see there is a distance between the origin of the leaflet and the junction, and the LA-LB junction, and then you measure this distance. So why are we mad about MAD? Is because this disjunction actually accelerates valve degeneration, causing annular dilatation, promotes myocardial fibrosis, which triggers ventricular arrhythmias. So there's growing evidence to support an association between mitral annular disjunction and arrhythmic events in patients with and without mitral valve prolapse. So even if you don't have mitral valve prolapse and you have a mitral annular disjunction, you still are at risk of having arrhythmia and sudden cardiac death. The prevalence of mitral annular disjunction it varies with the modality used. You could have it 17, so the reported percentages are 17.3 by using a transthoracic echocardiogram versus 25.5 using a transesophageal echocardiogram, and it really improves using a cardiac MRI up to 42%. Studies using transthoracic echocardiogram have found that there is no correlation between this disjunction and MR severity, so it really doesn't affect the severity of the MR in these patients. And as I said, that it is clinically relevant because it increases your risk of sudden cardiac death and arrhythmia, and it can potentially modify your repair technique. Thank you.